Good afternoon and welcome to our daily media briefing. Today we're going to get right into the speakers. We're going to be hearing first from Sheriff Gore, then we're going to be hearing from Nathan Fletcher to kind of give us an update on where things are with the homeless and other related matters. We'll be hearing from Dr. Wooten and then Dr. McDonald. And in order to get started, we'll kick off with our Sheriff, Bill Gore, to give us some important information.
Thank you, Greg. I think it's important to point out that law enforcement in San Diego County has worked very hard since the first order was issued to educate the public and seek voluntary compliance. And as I stand here today, I'm glad to say that probably 98% of the people of this great county have complied and voluntarily followed both the executive order from the governor and the public health order here in San Diego County. But I think we've got to take a step back and look at this and realize that the governor didn't put out an executive recommendation. Dr. Wooten didn't put out a public health recommendation to be followed when it's convenient. These are orders, and we're reaching a critical time in our county's public health history right now. And I think the days of trying to get voluntary compliance are really over. So the message is going to go out to all of public safety here in the county that we will start issuing citations for violation of the public order and the executive and the governor's executive order also. I think the public should know that the maximum penalty is a $1,000 fine for violation of these public health orders and up to 6 months in jail. So let's take it serious. Let's pull together as a community like we always do. Hopefully those citations will not be necessary, but that's the word that's going out to law enforcement now. The days really of voluntary compliance are over. So let's get through this thing, and the more compliance we have, the shorter the duration of these public health orders will be. So thank you very much for your cooperation.
Thank you, Sheriff Gore. Today is April 2nd. This is day 2 of our focused and aggressive month of action in April. To reiterate the point that we made yesterday, this really is the month that will set the trajectory and course for our region. As we come together as a community and truly commit to the efforts that have been laid out, we can avoid the devastation we've seen playing out across this nation and across the world, with hospitals being overrun with patients beyond their capacity to treat them. If we do not in the month of April, then we can expect as a region to encounter similar circumstances and situations. And for all the San Diegans that are in full compliance, and we know there are so many of you who are, we are eternally grateful. Your actions will save lives and help us as a region. For those individuals who are not, as the sheriff just mentioned, now is the time. The time for voluntary compliance is over. Now it is time for strict compliance throughout all communities, throughout all jurisdictions, throughout all areas. And if we come together in particular this month of April, we believe we can flatten the curve. We also know our early and aggressive actions on physical distancing, on mass gatherings, on stay at home, proper hygiene. We know that those are making a positive difference. And we know that if we continue to do them and we increase our adherence to them, that we can flatten the curve and we can sustain ourselves through the region. The early days in the outbreak of a pandemic are the days that are most critical, and it can be difficult at times to convey a sense of urgency when you aren't seeing the situations in San Diego like you are seeing in Italy or New York. But the simple reality is when you are seeing those scenes play out in your local jurisdiction, it is too late to do anything about it. And that's why we are pleading with the public for your full commitment and participation. This is the time as a region that we step up. This is not the time that we step back. In this spirit of increased action and focus, today our public health officer is amending several public health orders. Effective midnight on Friday, an order will go into a place that is strongly recommending the public follow the state's guidance on facial coverings. Now, we want to be really clear that we are talking about a facial covering, not a medical mask. If you have a medical grade mask, we ask you to take that to a medical facility or to the County of San Diego so it can be deployed to our frontline healthcare workers. They are the ones who need the medical grade equipment. However, there is some evidence to suggest that a facial covering can help you inadvertently stop the spread and can protect you. But one of the most vital points that we can make to the public as it relates to face coverings is that this is only in addition to everything else that you are already doing. If you are staying at home, if you are leaving your house for an essential purpose only, then when you leave your house for that essential purpose, we encourage and recommend that you have a face covering. But you have to continue physical distancing. You have to continue to wash your hands. In particular, before you put on or take off your mask, it is vitally important that you wash your hands aggressively for 20 full seconds with soap and water. One of the potential downsides of a mask is you're more likely to touch your face. And so as we encourage you to have a facial covering, we encourage you strongly before you put it on or take it off to make sure that you wash your hands. And again, to reiterate the point, a face mask does not stop you from getting it. It may lessen the probability you will transmit it if you are unaware you have it. It may provide some protection from you getting it. But the most effective measures that must be followed first is stay at home, only leave for essential purposes. If you do leave for essential purposes, ensure proper physical distancing and wash your hands. In addition to the strong encouragement for the general public around facial gatherings, we are issuing a mandatory facial covering for all employees of businesses who interact regularly with the public, and we are outlining those to include grocery stores, pharmacies, gas stations, and convenience stores. For these facilities, starting at midnight Friday, your employees who interact with the public must wear a face shield, a face protection, a face covering. Let me be clear, the best way to protect yourself from COVID is to follow the guidance we repeat daily: wash your hands, practice social distancing, stay at home. But we do believe, consistent with what the state of California issued today and with what other jurisdictions are doing, that there is a benefit and a value to face coverings in addition to all of the measures we should do. So to reiterate, we are recommending to the public, if you leave your home for essential reasons, you should cover your face. And if you are a worker at one of the entities we outlined, grocery stores, pharmacies, gas stations, convenience stores, or the like, you shall have your employees with a face covering effective midnight on Friday. In addition to that order, we are going to require businesses to put in place a social distancing, physical distancing protocol. All essential businesses that are operating today, effective midnight on Monday, must have and make available to the public and provide to your employees your protocols and procedures for how you will ensure physical distancing and hygiene standards in your place of employment. This document must be posted at or near the entrance of the facility. It must also be provided to your employees. As a county, on our website, we will provide some forms, some suggestions, some examples, some recommended type language that you can consider when you use. But it is critical to ensure proper physical distancing for all of our essential businesses that remain open throughout the duration of this crisis. Our next area of public health orders that are being issued today relate to public parks and recreational areas. Those entities must also, if they remain open, post their physical distancing plan. We also will be calling for the closure of all parking lots effective midnight Friday for parks and recreations throughout all jurisdictions in San Diego County. Again, the initial order remains in effect, which is each jurisdiction can decide on their own to open or close their parks and recreational facilities. However, if they are open, they must ensure and be able to ensure physical distancing is met. If they cannot ensure that, then they shall close. The reality is, as some jurisdictions have remained open, we've seen an inordinate amount of folks from other areas go to those jurisdictions, making it more challenging to ensure physical distancing. And by closing the parking lots, we can ensure that local folks who can walk or get there easily can still maintain them, but they do not become a large-scale gathering place for our region. And so all parking lots at park and recreational facilities throughout San Diego County will be closed effective midnight on Friday. We are restricting activities at all of these facilities as well to passive recreation. This is walking, this is hiking. You can do these types of things, but issues like basketball, volleyball, group activities, and those types of active participations will be prohibited throughout San Diego County. And Sheriff Gore just mentioned the enforcement protocol and procedures that his department will be taking and encouraging others to take. Let's jump into the quick number updates and charts. The first chart you will see here, we are reporting an increase of 117 positive cases, which takes us as a region to 966 total cases. Again, even with all of the efforts and actions we're taking, we do expect these numbers to continue to increase. We believe, we know they would be increasing at a much greater rate had we not taken the steps we've taken, and that's why we are still encouraging and requesting the public's not only continued commitment, but increased commitment as we head into the vital days of May. The next chart you will see is the number of tests. You will see a significant spike in the number of tests we are reporting, 2,607, the single largest day. Again, to reiterate the point we make every day, you can't determine a lot on day-to-day test results. These are often batched. They are often reported in large numbers. And so there's no expectation that this is the number we will see every day. This is just simply a reflection of this date and time. But as you can see, the broader trend is our region continues to see an increase in testing, and we continue to work incredibly hard, as do our health system partners who are to be commended. Yesterday we mentioned the story came out that San Diego County had the highest number of tests per capita of any county in California, and that is encouraging news for us, but we continue to seek and look out for more opportunities for testing. The hotel room population here, a total, again, public health rooms. We are going to work with our healthcare providers to make sure that they know that these rooms are available for anyone who tests positive, who does not feel confident in their ability to isolate at home or wants to avoid potential exposure to a vulnerable population or to their family members. Those rooms are there and remain available. And we've covered in great depth the last few days the role of the Regional Task Force on Homeless Rooms, and you see an uptick there. Our outreach efforts, our calls to the nurse line continue to increase. Our epi-related calls from our healthcare partners continue to increase. The number of hygiene kits distributed continue to increase. Hand washing stations, we are in the process of installing several that have been requested. The number of toilets distributed declined slightly because they were at one location that was being used for a specific healthcare purpose. That location is no longer needed, and so we have taken those 4 back, and we will site additional public toilets as those requests come in. Next chart here is on ventilators. You'll see a decline in the number. This is not unexpected. We'd said there would be fluctuations on a day-to-day basis. At the time we pulled our reports, a few of the hospital systems that reported yesterday did not get their reports in time. And so again, we will see fluctuations in that number day-to-day based on the number of hospitals who have reported the daily total available at the time we prepare the report. The number that we have in the county that are ready to deploy has increased. That is consistent with the second line there, those being surfaced, completing their service, being returned to the county, and ready to deploy. And we continue to await information or guidance from the state on our request for them. And we continue to await the arrival of the units that we have purchased in the market. Final chart here relates to personal protective equipment. We had a very significant jump from yesterday to today, which is just reflective. Every day we try and gather PPE. Every day we push out whatever we can. You can see in the last 24 hours we've distributed more than 100,000, almost 100,000 more N95 respirators. We've distributed well over 100,000 surgical face masks, a quadrupling in the number of face shields, increase in goggles, gowns, jump in the number of gloves, and we are now over 1.3 million individual items of personal protective equipment that has been distributed by the County of San Diego to our healthcare partners, and we continue to do everything we can to provide to them what we believe they need based on our available supply and what we're able to acquire from the state, from the federal government, and through our direct purchase with others. Thank you.
Good afternoon, everyone, and thank you for being here. The health officer order dated March 27th and effective as of midnight on Sunday, March 29th, is amended today and is effective as of 12 midnight on Friday, April 3rd. Section 1 of the health officer order shall be amended to add new subsections as follows. The California Department of Public Health face covering guidance was issued yesterday, Wednesday, April 1st. This guidance shall be followed in the County of San Diego, except in the following areas which are more restrictive. Effective midnight Saturday, April 4th, all employees who may have contact with the public in any grocery store, pharmacy or drugstore, convenience store, or gas station shall wear a cloth face covering as described in the California Department of Public Health face covering guidance already referenced. The second is that all businesses that remain in operation in accordance with the health officer's order and that allow members of the public to enter their facilities must prepare and post by no later than 12 midnight on Tuesday, April 7th, a social distancing and sanitation protocol. And that will be a document that will be available. It's fill in the blank, very simple. Last, all public parks and recreation areas, including public beaches, shall close their parking lots at these facilities, and all such facilities shall be accessible only by members of the public within walking distance of these locations. Said facilities shall be used solely for walking, hiking, or bicycle riding. The public shall not congregate or participate in active sports activities at said facilities. So now I would like to welcome Dr. Eric McDonald, who will review our cases for today. Thank you.
Thank you, Dr. Wooten. Unfortunately, globally, we just passed a significant milestone. Over 1 million cases of COVID-19 have been reported worldwide. We have about 250,000, we're approaching 250,000 cases here in the United States and approaching 10,000 cases in California. As Supervisor Fletcher mentioned, we have had 966 positive cases here in San Diego residents, and we reported today that COVID-19 has claimed another death in San Diego, a 98-year-old woman, bringing our total to 16. I do want to mention to the media who are following this that we will be producing a daily line list of the individuals who have died from COVID-19, similar to what we do with influenza, that shows age, gender, and location in the county that the person resided. I'll just summarize to say that the deaths have ranged from 25 years old to 98 years old. Of our local cases, of 966 residents with COVID-19, 573, or 59%, are between the ages of 20 and 49. 514, or 53%, are male. 181, or 19%, have been hospitalized, and 70 have been admitted to intensive care units, so that's approximately 7%. There are 7 confirmed skilled nursing facility or long-term care facility outbreaks in San Diego County. Collectively, they total 41 cases and 3 deaths. There are 4 confirmed community outbreaks comprising 15 cases and 1 death. I'll give a brief update on the cruise ship situation. The Celebrity Eclipse remains in port here in San Diego. There was a crew member taken overnight to the hospital and returned to the ship today. This individual was a known COVID-positive patient, was in isolation, was transported with appropriate precautions, and remains in isolation on the ship. The Celebrity Millennium, which is just off the coast, had a crew member evacuated to San Diego County yesterday morning with cardiac and respiratory symptoms. This individual was treated and released at a local hospital and is being returned to the ship today. As a precaution, this individual was tested for COVID and is negative for the virus. There are no known COVID cases on the Celebrity Millennium. And just in closing, as speaking for our regional healthcare partners, I ask you again to do everything you can to lower our curve and to follow the health officer orders that have been issued and are being amended, as Dr. Wooten mentioned. We'll be clearly topping 1,000 cases tomorrow. Frankly, you should be staying at home, going out for essential tasks only, and when you do, essentially treat others as if they might have COVID and be distant from them. They should treat you the same way. And so I'm offering my personal endorsement to use these facial coverings. Save the masks for healthcare workers, but use the facial coverings. And I would just summarize it by saying, stay safe, and when you leave your place, cover your face. I'll turn it back to the supervisor.
Before we get to the questions, I just wanted to follow up on Dr. Wooten's public health directive. We're going to need your help in enforcing this update. And so what we'd like to do is to help law enforcement, and we're going to be using 211 San Diego to establish an online reporting system for people to notify us if they see violations by a business. What we want the public to do is simply go to 211sandiego.org to fill out an online form. Once again, that is 211sandiego.org. That system will be up and running by tomorrow once this order takes effect. Let's please be responsible with this system. If you see a violation of the facial covering order, report it to the store or business manager first. If that violation is not corrected, then please report actual violations of the order to 211sandiego.org. Thank you. We'll go straight to the questions now. I believe we have 4 waiting. And again, if you're not identified by name and outlet when you're introduced, please do so. First question.
iNewsSource, please state your name and question.
Hi, this is Jill Castellano from iNewsSource. Thank you for the updates. I'm asking, in addition to the 90,000 bandanas that the county purchased last week, I've been told that the county is about to purchase an additional 41,000 bandanas on top of that. I'm hoping you can confirm that additional purchase of 41,000 bandanas and explain how all these bandanas are being used, where they're going, who they're going to.
Okay, as far as the order part, let me call up Rob Sills, who's our logistics officer, and then Dr. Wooten will talk about the deployment of them.
Yes, good afternoon. We're actively purchasing bandanas as far as other reusable face coverings. And these are for the purpose of guests at the convention center, as well as folks that are in the hotels that may not be able to go and purchase these on their own or get them on their own, so that we can give them to non-healthcare workers. We're saving our surgical mask and our supply of N95s for healthcare workers.
Thank you.
This is Dr. Wooten. I'd just like to add that we are encouraging individuals that they have their own masks that are in these 4 categorical businesses. They can use their own mask. And if employees choose to provide them, they can do that as well. But we want to ensure that everyone understands we are not recommending that for these categories that they use, as has already been stated by Rob Sills, the surgical masks or N95 masks. You can cover your face with any type of fabric, a bandana, turtleneck. There are numerous types of cloth materials that can be used for this purpose, to cover your nose and your mouth. So and you see some pictures that are being projected behind me. So that is our suggestion to these categories. And as stated by the California Department of Public Health, anyone in the general public, if they choose to do so, can utilize these materials. But understand there are pros and cons. And particularly, it can give you a false security, if you will, and then as you're touching your face, you could be potentially infecting yourself if you haven't washed your hands. So everything that we've told you up until this date is you should still be doing that, washing your hands, keeping the 6 feet distance, staying home if you're sick. So this is in addition to everything that we have guidance and health officers' orders that we have provided to this date.
Great, thanks so much.
Okay, let's go to the next question.
NBC7, please state your name and question.
Hi there, my name is Lauren Coronado. I'm with NBC7. I have a question about false negative tests. I know it's happening in other parts of the state. If someone's tested negative, they get a second test down the line and are positive, which of course is concerning if they leave their home for any essential need. Is that an issue here in San Diego? Are we seeing that?
Dr. McDonald will answer that question.
Thank you.
Yeah, thank you for that question. We don't have too many examples of individuals being serially tested, but I can tell you that the single largest reason that there may be a false negative test is inadequate collection of the sample, or somebody who sampled when they don't have symptoms. So sometimes people are exposed and they're concerned, they're in self-quarantine. They might be sampled for some reason with no symptoms, but then they develop symptoms later and they're tested and they're positive. That's an important issue to know, that, and the reason why we don't test people without symptoms, even when they've been exposed. That's not really a false negative. It was negative and it was true at the time because they weren't yet symptomatic. So I hope I've answered your question. Again, there's sort of two parts. Again, most of it has to do with collection, or frankly, people who are being sampled when they shouldn't be.
Okay, thank you. Are we seeing that here in San Diego more often, or if you can kind of talk about that?
Well, at the beginning I said that we don't really have evidence of very many of those kinds of cases here in San Diego.
Okay, thank you.
Okay, let's go to the next question.
Associated Press, please state your name and question. Will the Associated Press reporter please state your name and question?
Okay, let's go to the next caller.
Union Tribune, will you please state your name and question?
Oh, hello, this is Gary Ward from the San Diego Union Tribune. And I had a question, I guess it's for Sheriff Gore. The crackdown on businesses that are not essential but still operating, would that happen immediately? Does it happen tonight? And I was confused about what authority would be going after them. Would that be sheriffs, or would it be individual jurisdictions, police departments? And what sort of violations or what sort of businesses are you looking at as a priority? Like, are there, like, is there a priority for businesses that might be in violation? Like, would a tattoo parlor, for instance, have higher priority than another type of business?
I'll let Sheriff Gore answer that question.
Thank you. We want all businesses reported to law enforcement that are not deemed essential but are still in operation. And it's not just the Sheriff's Department that can enforce the governor's order or the county public health order. It's any local law enforcement agency in the county of San Diego. So feel free to report those either through 211 to us or to call our non-emergency number. Those will be checked out.
And again, does that happen tonight at midnight? And also, I was curious, I saw that LA was threatening to cut off the power and water to businesses that are in violation. Has there ever been any talk doing anything like that, or is that a little early for that?
The question, I understood it, these are non-essential businesses. This order doesn't impact them. They shouldn't have been in operation anyway, and we want those businesses reported to law enforcement, either through our non-emergency number or using 211, and they will be investigated and they will be cited if appropriate. The order that we're talking about, the extension of the order now, is the masking of certain essential businesses that have been declared essential that have interaction with the public.
Okay, thanks.
Okay, let's go to the last call-in question.
Channel 8, please state your name and question.
Hi, this is David from Channel 8. I had a couple questions that I think the public is concerned about. Number one, why isn't the county giving us its modeling showing when they believe, or a range of when they believe, we will reach the maximum bed running out of hospital beds? The county has to have modeling on that, and I think it's a public interest to know when we might run out of hospital beds and what your modeling shows. And then my second question is on respirators. My second, I was talking to Scripps the other day. They said they're ordering their own respirators, but also the county is helping them ordering respirators. And I noticed on your list you have 600 respirators on order. I was interested to know, how does the county distribute those respirators to all the hospitals in the county? How do you decide mathematically, for example, which hospital gets how many respirators? Thank you.
Okay, Dr. Wooten will answer the first part of that question.
Thank you, Supervisor Cox. I want everyone that's looking at me right now to understand, and this includes media, that we're not trying to keep anything from anyone. We are trying to understand the data. There are various models that we are exploring. We have researchers looking at each of the models and comparing them. When we give information, we want it to be the best and most accurate information that is possible. And we recognize that models are estimations. They are just that, estimations. And as we get more data, we will plug that into the model to help us have a more accurate depiction and representation of what our region looks like. So we have researchers, as I stated, working on that with us. And when we have something that we feel is adequate to bring before the public, we will indeed do that. But in the process, we will continue to plan. We will continue to implement our social distancing strategies, because those are the things that are evidence-based and that will flatten the curve, as you have heard us so often say, and help prevent us from overburdening our healthcare system. Thank you.
And to respond to your question about the respirators, I think you're talking about ventilators. I'm in contact with Scripps Health as well as other our health care facilities, hospitals, and the normal day-to-day actions that they take is they go through their own supply chains for ordering and receiving PPEs, ventilators, and PAPRs, all of that stuff. When that supply chain stops and they use up their inventory, they come to the county, and we assist through our connections with the state and federal government where we get our resources. So I believe your question really had to do with ventilators, and yes, they have gone out on the open market to purchase ventilators, as have we. Everyone is. We're also working with the state and feds to get the ventilators that we requested from the state in. I think the last part of your question had to do with, when do we release our cash out to the hospitals? That's a great question, and that's something that we're doing every day. Is we're in communication with the hospitals, and they complete a resource request saying, hey, this is how much we have left, this is how quickly we're using them, we need assistance, we have about a week's worth, we have a month's worth, whatever that is, and we're in communication, and we do whatever we can to fulfill that. The numbers that Supervisor Fletcher showed earlier on the slide show the number of available ventilators that we have. I believe there are 88, if my memory serves me correctly, ready to deploy right now. However, there are, thank you, 456 out in the hospital systems. We are not going to deploy our 88 until those numbers are down, and they are using theirs, and then they're like, hey, you know, they're in communication with us, we need additional ones. We forecast that we're going to need this, and that's when we put ours into play. So I'm hoping I was able to clear that up. Thank you.
Yes, thank you very much. I appreciate it. Yes, I was talking about ventilators, not respirators.
Okay, thank you. We're going to go to the text questions now. The first one deals with the post office, and we're going to ask Dr. Wooten to answer that question.
I think actually Dr.
Oh,
McDonald.
Dr. McDonald's going to answer.
The question is from Mario from CVS 8. We learned today a Rancho Bernardo postal carrier tested positive for COVID-19. Previously, you've said that the virus can stay on cardboard. Is our mail something we should be concerned about?
That's a great question, and I think it's one that people do worry about. I think I would give a general answer to that anything that you bring into your home that you didn't have control over, you should probably look at carefully, and after you handle, wash your hands. Again, I open my mail every day, and I'm able to look at it and throw away what I don't need and recycle some, and actually most, and then I wash my hands afterwards before I do something else. You do something just as simple as that, you're going to be well protected in your home.
Thank you, Dr. McDonald.
Okay, we have the next texted question is a two-part question, and I think Supervisor Fletcher is going to answer that question.
Yes, this is from Claudia from Univision. What is the latest number of unemployment applications submitted in San Diego County is her first question.
I don't know off the top of my head. The state of California EDD department tracks the number of unemployment claims. We can check with them and see if they break it out by county, but off the top of my head, I don't know the state's number.
And the City of LA announced new measures for construction workers, which include not sharing tools or phones. In San Diego County, are we thinking about adopting similar measures?
Well, that's just a common sense type thing that we would think all construction entities would already be doing. The issue of construction sites the governor addressed today, the state building trades has made a series of protocols they've put out surrounding the actions they'll take at each of their construction sites to ensure physical distancing and hygiene standards. We think those are good and wise, and we'll obviously continue to monitor all situations and make appropriate guidance. But we do encourage all essential businesses that are open and are operating to follow all of the guidance that have been given around physical distancing when possible, around hygiene efforts, around efforts to protect their workers, and that should be taking place in all of them.
All right, thank you.
The next question we have is going to be answered by Dr. McDonald, and I'll go ahead and read the question now.
All right, thank you. This question is from Connie. Could you please let me know if the chart by zip code for coronavirus cases incorporates hospitals in that total number? 92103 has 2 hospitals in that census tract. It is the highest amount of cases in the county. And is that related?
I think that's a good question. It's come up in previous news conferences before. People do go right to that page and look at their location and look at their zip code and see how many cases are there. I think it's only natural. We produced that report because people wanted to know cases by location, but there's a big star by that, a big caveat that really the information is not terribly meaningful. For several reasons. One, just where somebody lives doesn't mean that's where they were infected or in fact were exposing others. I think a great example of that is the case that lived in Orange County but worked down here, so there's that issue. Number two, we only know about the cases we know about, and some people may be getting tested more often, and so that might be a factor, but it is true that the hospitals in that specific zip code, if they see individuals and don't get information that is complete about where they live, they often have a protocol to default to the hospital zip code address, and that may be contributing to some of this. This sometimes is fixed over time by our epidemiologists when we do repeat interviews, which is why all of the information that we put out is considered preliminary. We get more information, information will be changed, and we will have much better data sets as time goes by.
The next question has to do with testing capacity, and Dr. Wooten will answer that question.
Thank you, Chairman Cox. This question is from Amy. Can you please tell us about your testing capacity? What is it, and does it have any limitations? Is there any kind of a backlog or delay in collecting specimens and or getting results?
Well, we've explained our capacity, and I'm very happy to go over that again. We have 3 buckets, if you will, of testing capabilities in the county. The first is the testing capability at our county public health laboratory. We have 3 different platforms, 2 that are already that have already been stood up, and 1 that is pending. Because the machine is on back order because everyone else wants that same machine. So the first is the CDC test kits that comes separate from the reagent, which has been a rate limiting step for conducting testing with that test kit. The second is Abbott M2000, and that comes with all of the elements needed to run the test. We can run a total of 90 tests in a given run, and in a 24-hour period, 180 tests. So that has significantly increased our capacity at the county. The third platform is the hologic genomics testing, which can actually, in a 24-hour period, test over 1,000 specimens, but we don't have the machine yet because it's on back order. So that's bucket number one. Bucket number two is our local hospital capacity. We have 7 hospitals that are currently now testing locally. And then the third is our commercial laboratories, and now we have 4 commercial laboratories that are providing testing. With the commercial laboratory, it takes 5 to 7 days because many of them are not located locally. They have to send them out of the county and actually even the state. So that is the local testing capacity in San Diego. And as Supervisor Fletcher stated earlier, we have asked, and this is part of a previous health officer's order, all entities to report not only the positive tests, but negative tests, so we can look at the percentage of positive tests to the overall number of tests conducted. Thank you.
Thank you, Dr. Wooten. I think this next one can be answered by you as well. It's from Justina Myers from Fox 5. Why did this face mask request take so long? What changed so that we are now asking people to do this, and are we following the lead from LA and New York?
Well, you know, in the region, you take the information that's available to you, and the covering the face really is to prevent those individuals that might have minor symptoms from transmitting symptoms to others. So that's the reason. And we have, throughout the last 3 weeks, given health officers orders for all of the evidence-based tools in our toolbox. Now we're down to other tools that there's no harm in trying. So that's what we've done with the order for face covering, fabric face coverings in those locations, again, grocery stores, gas stations, convenience stores, and pharmacies, where people have to go to get their food, to get their medication. It's just another step that we are utilizing to help keep our community safe.
And Dr. Wooten, I think just for her clarification,
Yes.
she's asking whether businesses and employees will be fined if law enforcement plans to patrol businesses and when those patrols would begin.
So as we get complaints, we will investigate those complaints and determine what the next step is. As I've stated in previous briefings, not complying, this is an order, so not complying with this order would consider to be a misdemeanor, subject to a $1,000 fine. But again, we want people to comply so that we don't have to issue fines to individuals or businesses.
All right, thank you, Dr. Wooten.
Thank you, Dr. Wooten. What's the next text question?
The next question is from Paul Sisson. I'm not sure who can help us with this. From the Union Tribune, roughly how many reports has the county received of people or businesses violating social distancing orders since the public health order was issued on March 17th?
Okay, I'm not sure that we have any information available right now, but Paul will try to follow up with you.
Okay. All right. I'm going to go to a question from Taryn Mento from KPBS. She has a question for all or anyone who can answer. I see the county on its Twitter feed is reminding people to care for their mental health during this time, and the governor yesterday acknowledged the difficulty for parents as he knows they're struggling with the schools closed. How are you all doing with these challenges, plus the challenges of your jobs right now, and how are you taking care of your own mental health?
Dr. Wooten's going to answer that question.
Well, I'll start out by saying everyone copes differently. So some people need to exercise, some people need to meditate, some people need to stay connected to friends. So whatever your method of coping is, we want and encourage people to do that. I've also stated that, you know, this experience has given us the gift of time. And those individuals that are working from home or not working from home. With schools, many of the schools are now online. It's an opportunity to continue one's education or to continue to work at home. So it is a gift of time, and I encourage people to take advantage of that time and do things that bring you joy and help to give you comfort and solace, whether it's meditation, whether it is listening to music, whether it's exploring your creative side by writing or painting. But everyone responds to stress differently. For those individuals that are stressed and do need to have someone to talk to, our Access and Crisis line is available, and we've given that number out, and it's available on our website.
Thank you. And Dr.
Yes.
David from Channel 8 is trying to clarify. He's asking, why do restaurant workers preparing delivery food not have to wear face masks or drive-through restaurant workers?
In that particular situation, the 6 feet distancing is more in play. So that's why we didn't include that in the order today. But again, this is the information that we provided to you today is above and beyond what the state has provided, and these orders could change. There could be additions made in the coming weeks. So as we find out about more information, we will certainly update our orders and make those known to you.
Thank you, Dr. Wooten.
That completes our media calls for today, but before we sign off, I know we've been sharing a lot of grim news over the last few days, but I wanted to close on a more uplifting and positive note. Although we certainly are in a crisis, I remain inspired by the many acts of everyday San Diegans that have really stepped up to help their neighbors and their community. Recently, there was a story in the Union Tribune about a random act of kindness, and there certainly are plenty of those stories going around. There was a librarian from Calavera Hills Elementary School in Carlsbad who offered free drive-by storytelling services to local families. Lambs Players Theater in Coronado has posted videos on its web book page, including one of its performers doing an a cappella version of What a Wonderful World that's become a viral sensation. There was an 11-year-old girl from Pacific Beach Elementary School who spent 3 hours one day drawing rainbows, flowers, and messages like smile on her driveway as part of a Chalk the Walk campaign to spread positivity. And today I learned of volunteers from the Chula Vista Veterans Home Support Foundation who collected over 200 face masks to donate to the staff at the Veterans Home. This is going to allow the nurses there and the staff at the Veterans Home to continue taking care of our brave and dedicated veterans. As one of those volunteers put it, we've got to take care of the really important people who took care of all of us. One final note, you know, with the new order that's come about in regards to shielding your face, it's pretty easy to come up with either a bandana. I know my daughter got on Google and found some patterns to make a simple face mask that you can do at home if you have a sewing machine and some flannel materials or other materials. Bandanas work great. And again, I think all of this is an effort to be additive to the other orders that have been laid out before to make sure you keep that social distance, that you wash your hands, and that you cover your face. And it's really probably something everybody should be doing when they go out in public. And again, we certainly appreciate everybody's listening to these media briefings. Again, we encourage people to live well, to stay well, and to stay well, stay home. Thank you, and we'll see you tomorrow at 2:30.